How to treat and cure bone cancer. This section outlines treatments that are the standard of care, the best proven treatments available for this specific type of cancer. When making treatment plan decisions, patients are also encouraged to consider clinical trials as an option. A clinical trial is a research study to test a new approach to treatment to evaluate whether it is safe, effective, and possibly better than the standard treatment. Clinical trials may test such approaches as a new drug, a new combination of standard treatments, or new doses of current therapies. Your doctor can help you review all treatment options. For more information, see the clinical trials section and latest research sections. Symptoms and causes. Symptoms. Signs and symptoms of bone cancer include bone pain, swelling and tenderness near the affected area, broken bone, fatigue, unintended weight loss. When to see a doctor. Make an appointment with your doctor if you or your child develops signs and symptoms that worry you. Causes. Illustration showing osteosarcoma, osteosarcoma, illustration showing Ewing sarcoma, Ewing sarcoma. It's not clear what causes most bone cancers. Doctors know bone cancer begins as an error in a cell's DNA. The error tells the cell to grow and divide in an uncontrolled way. These cells go on living, rather than dying at a set time. The accumulating mutated cells form a mass, tumor, that can invade nearby structures or spread to other areas of the body. Types of bone cancer. Bone cancers are broken down into separate types based on the type of cell where the cancer began. The most common types of bone cancer include osteosarcoma. Osteosarcoma begins in the bone cells. Osteosarcoma occurs most often in children and young adults, in the bones of the leg or arm. Chondrosarcoma. Chondrosarcoma begins in cartilage cells. It usually occurs in the pelvis, legs or arms in middle-aged and older adults. Ewing sarcoma. It's not clear where in bone Ewing sarcoma begins, but the tumors most commonly arise in the pelvis, legs or arms of children and young adults. Risk factors. It's not clear what causes bone cancer, but doctors have found certain factors are associated with an increased risk, including inherited genetic syndromes. Certain rare genetic syndromes passed through families increase the risk of bone cancer, including Li-Fraumeni syndrome and hereditary retinoblastoma. Paget's disease of bone. Most commonly occurring in older adults, Paget's disease of bone can increase the risk of bone cancer developing later. Radiation therapy for cancer. Exposure to large doses of radiation, such as those given during radiation therapy for cancer, increases the risk of bone cancer in the future. Treatment overview. In cancer care, different types of doctors often work together to create a patient's overall treatment plan that combines different types of treatments. This is called a multidisciplinary team. Oncologists are doctors who specialize in the care and treatment of people with cancer. Descriptions of the most common treatment options for bone cancer are listed below. Treatment options and recommendations depend on several factors, including the type and stage of cancer, possible side effects, and the patient's preferences and overall health. Your care plan may also include treatment for symptoms and side effects, an important part of cancer care. Take time to learn about all of your treatment options and be sure to ask questions about things that are unclear. Also, talk about the goals of each treatment with your doctor and what you can expect while receiving the treatment. Learn more about making treatment decisions. For a low-grade tumor, the primary treatment is surgery. The goal of surgery is to remove the tumor and the margin of healthy bone or tissue around the tumor to make sure all of the cancer cells are gone. For a high-grade tumor, oncologists often use a combination of treatments. These include surgery, chemotherapy, and radiation therapy. Surgery. Surgery is the removal of the tumor and surrounding tissue during an operation. Surgical oncologists and orthopedic oncologists are doctors who specialize in treating bone cancer using surgery. Surgery for bone cancer often involves a wide excision of the tumor. A wide excision means that the tumor is removed along with a margin of healthy tissue around it in all directions. Learn more about cancer surgery. If the tumor is in an arm or leg, limb-sparing techniques are used whenever possible. However, amputation, which is the removal of the arm or leg with the tumor, may be needed depending on the tumor's size and/or location. Wide excision surgical techniques have reduced the number of amputations performed for patients with bone cancer. More than 90% of patients can be treated with conservative, limb-sparing surgery compared with amputation. These surgeries often require prostheses, such as metal plates or bone from other parts of the body, to replace the missing bone and provide strength to the remaining bone. This is called reconstructive surgery. Surgeons use soft tissue, such as muscle, to cover the reconstruction area. The tissue helps with healing and reduces the risk of infection. For some patients, amputation may offer the best option. These include patients whose cancer is located where it cannot be completely removed by surgery, patients who cannot undergo reconstruction, or when the surgical area cannot be fully covered with soft tissue. Children with bone cancer may require amputation more often than adults since their bones grow more. To avoid amputation, some children can be fitted for expandable joint prostheses that adjust as the skeleton grows. These prostheses require multiple operations to adjust bone length as the child grows. It is important to remember that the operation that results in the most useful and strongest limb may be different from the one that gives the most normal appearance. If amputation is needed, rehabilitation that includes physical therapy can help maximize the patient's physical functioning. Rehabilitation can also help a person cope with the social and emotional effects of losing a limb. Chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells, usually by stopping the cancer cell's ability to grow and divide. Chemotherapy is given by a medical oncologist, a doctor who specializes in treating cancer with medication. Systemic chemotherapy is delivered through the bloodstream to reach cancer cells throughout the body. Common ways to give chemotherapy include an intravenous, tube placed into a vein using a needle or in a pill or capsule that is swallowed. A chemotherapy regimen, schedule, usually consists of a specific number of cycles given over a set period of time. A patient may receive one drug at a time or combinations of different drugs at the same time. Chemotherapy for bone cancer can usually be given as an outpatient treatment, which is treatment given at a clinic or doctor's office instead of requiring the patient to be admitted to a hospital. Surgery alone is not usually enough treatment for patients with some bone cancers, particularly osteosarcoma. These cancers sometimes recur as distant metastases, most often in the lungs, that were most likely only able to be seen with a microscope when the person was diagnosed. The use of chemotherapy has increased survival rates for people with some types of bone cancer. In addition, chemotherapy is often useful for treating cancer that has visibly spread at the time of diagnosis. Fast-growing bone cancer is often treated with chemotherapy before surgery. This usually reduces the size of the primary tumor and may destroy tiny areas of metastasis if some of the cancer cells have spread to other areas. Chemotherapy that is given before surgery is called preoperative chemotherapy, neoadjuvant chemotherapy, or induction chemotherapy. For most high-grade tumors, the oncologist gives chemotherapy for 3 to 4 cycles before surgery to shrink the primary tumor and make it easier to remove. Chemotherapy before surgery may also improve survival, since it destroys cancer cells that have spread from the original tumor. The tumor's response to chemotherapy, which is evaluated using a microscope after the primary tumor has been removed, can be used to better determine the prognosis. After the patient has recovered from surgery, he or she may receive additional chemotherapy to destroy any remaining tumor cells. This is called postoperative or adjuvant chemotherapy. The use of chemotherapy to shrink the tumor before surgery combined with chemotherapy after surgery has saved many lives and many patients' limbs. In particular, chemotherapy is very effective for Ewing sarcoma. Some drugs used to treat Ewing sarcoma are cyclophosphamide, dactinomycin, doxorubicin, etoposide, ifosfamide, and vincristine, Oncovan. The side effects of chemotherapy depend on the individual and the dose used, but they can include fatigue, risk of infection, nausea and vomiting, hair loss, loss of appetite, and diarrhea. These side effects usually go away once treatment is finished. Learn more about chemotherapy and preparing for treatment. The medications used to treat cancer are continually being evaluated. Talking with your doctor is often the best way to learn about the medications prescribed for you, their purpose, and their potential side effects or interactions with other medications. Learn more about your prescriptions by using searchable drug databases. Radiation therapy. Radiation therapy is the use of high-energy X-rays or other particles to destroy cancer cells. A doctor who specializes in giving radiation therapy to treat cancer is a radiation oncologist. The most common type of radiation treatment is called external beam radiation therapy, which is radiation given from a machine outside the body. When radiation treatment is given using implants, it is called internal radiation therapy or brachytherapy. A radiation therapy regimen usually consists of a specific number of treatments given over a set period of time. For bone cancer, radiation therapy is most often used for patients who have a tumor that cannot be removed with surgery. Radiation therapy may also be done before surgery to shrink the tumor, or it may be done after surgery to destroy any remaining cancer cells. Radiation therapy makes it possible to do less extensive surgery, often preserving the arm or leg. Radiation therapy may also be used to relieve pain for people as part of palliative care. See below for more information. For patients with Ewing sarcoma, radiation therapy is often used along with chemotherapy and surgery. Ewing sarcoma that starts in a bone that cannot be surgically removed is treated with chemotherapy and radiation therapy. For osteosarcoma, treatment is usually limited to chemotherapy and surgery. Radiation therapy is used for recurrences or osteosarcomas that cannot be removed completely with surgery. Side effects from radiation therapy may include fatigue, mild skin reactions, upset stomach, and loose bowel movements. Most side effects go away soon after treatment is finished. Learn more about radiation therapy. Getting care for symptoms and side effects. Cancer and its treatment often cause side effects. In addition to treatment to slow, stop, or eliminate the cancer, an important part of cancer care is relieving a person's symptoms and side effects. This approach is called palliative or supportive care, and it includes supporting the patient with his or her physical, emotional, and social needs. Palliative care can help a person at any stage of illness. People often receive treatment for the cancer and treatment to ease side effects at the same time. In fact, patients who receive both often have less severe symptoms, better quality of life, and report they are more satisfied with treatment. Palliative treatments vary widely and often include medication, nutritional changes, relaxation techniques, and other therapies. You may also receive palliative treatments similar to those meant to eliminate the cancer, such as chemotherapy, surgery, and radiation therapy. Talk with your doctor about the goals of each treatment in the treatment plan. Before treatment begins, talk with your healthcare team about the possible side effects of your specific treatment plan and supportive care options. And during and after treatment, be sure to tell your doctor or another healthcare team member if you are experiencing a problem so it is addressed as quickly as possible. Learn more about palliative care.